Hi, my name is Ilana Herman. I'm a speech pathologist practicing for 40 years, working with a geriatric population in long-term care facilities, with long-term and short-term patients. It has been so frustrating trying to see someone who has the use of only one hand when they're eating due to having suffered from a stroke or other neurological diseases, or even from surgery, a shoulder or arm, hand surgery, and then they have the use of only one hand when trying to eat ice cream, Jell-O, pudding, yogurt, applesauce. So I came up with an idea. I invented the independent feeding tray. The molded cup, which is molded to the tray, either on the right side for someone who has the use of their right hand when eating, or on the left side of the tray for the person who needs to use their left hand when they're eating, allows that patient to eat independently. And the purpose of this innovative technology is to allow the patient to maintain dignity and independence when eating. This independent feeding tray is not only for use in hospitals, nursing homes, schools for children with special needs, but also when patients go home after having suffered a stroke, they still are limited with their ability to use only one hand when eating. So this can also be useful at home as part of the devices that they need in order to function as independently as possible. This is a prototype of the independent feeding tray with the molded cup that is molded to the right side of the tray. The molded cup has tabs that is going to secure the food item, the applesauce, yogurt, Jell-O, fruit cup, ice cream. It will secure it, the tabs will grip it, and the person who has the use of only their right hand for eating will be able to eat independently without having anyone help them eat. We have the same idea with the left-sided mold, also with the tabs that will secure the food item there. They'll be able, this is for someone who has the use of only their left hand when eating, and they will be able to eat that fruit cup, yogurt, ice cream, Jell-O, applesauce independently without having anyone assist them. So in your experience, have you seen anything like this independent feeding tray?
Well, ever since my infliction, I've been to about 2 or 3 nursing homes, and I have never seen anything like this. The idea of having something to hold a specific item in place. It's so much easier to eat from it, seeing that I don't have use of my left hand.
Show us how you do that, how you take a little bit of that ice cream.
I take it from the top. I wouldn't dare try to grab it from the bottom. It'd be too much for me to eat.
Right. You want to control the amount that you're putting in your mouth. How does it make you feel that I don't need to stabilize the cup for you, or you don't need a family member or one of the nursing assistants or a nurse to help you eat the ice cream?
It makes me feel more independent.
That's wonderful. And that's the whole goal and idea of the independent feeding tray.
Yeah.
We want our residents to be independent when eating and to maintain dignity when eating.
Well, this sure messes up to that.
So what do you find is the difference between using a regular tray like we have upstairs versus this independent feeding tray with the molded cup? Go ahead.
The difference is this tray here is just like eating on a table. There's no difference except from the table to the tray. But from this here to...
I just don't want your shirt to
Okay.
swallow.
Using the mold holds the cup in place just like a coffee cup in a car.
Exactly, just like a coffee cup in the car. What a great, great example. Right.
Because most people can relate to a coffee cup in the car.
Yes, yes.
But this is a pleasure. As you can see, it's stable. It
Yes.
doesn't move.
Okay.
Now, if you were to do that with this, the same thing here, here,
All right, show us how you would do it there. Right. So what,
it'll be skating around. You can't help nothing. Help it.
and you know what, there's one more thing that I wanted to show, Mr. Mike Bike. Remember the other day, we put it on the left side. So you also were working on strengthening your left side,
Yeah,
and you had to like reach over a bit.
okay.
You had to turn a little bit more to the left to get the ice cream. So your head is turning a bit.
Yeah.
You're focusing more on your left, which is one of the skills that you're working on.
Right.
So it actually has two purposes. One, to make it easier with eating on the right side of the tray with your right hand. Still using the right hand, but you're focusing on turning your head more towards the left, strengthening your left visual,
Yeah.
which is something that also is important to
No,
work
that's
on.
a great idea.
Thank you.